Welcome, Georgia school leaders, to this explainer. Today we're tackling one of the most pressing, frankly vital challenges facing your districts right now. Okay, let's dive right into this. We're looking at the absolutely critical difference between having a pristine, perfectly tabbed binder full of protocols sitting neatly on a shelf and having true, actionable clinical capacity. Because, when it comes to school mental health readiness, paper compliance and actual capacity are two completely different beasts. And honestly, confusing the two, that can leave your schools incredibly vulnerable.
Here's our roadmap for today. We're going to briefly cover compliance versus clinical capacity, the Tuesday 9 a.m. test, the reality of school staffing, building true functional readiness, and finally, we'll wrap up with the MentalSpace school solution.
All right, Section 1, Compliance versus Clinical Capacity. We know you put immense work into your readiness plans, but we really need to make sure we aren't confusing an audit checklist with an actual clinician.
So let's step into reality for a second. Ask yourself this. If a student in crisis walked into your building tomorrow at exactly 9 a.m., how many hours until they actually see a licensed clinician? Not how long until they're placed in a safe room, not how long until a form gets filled out, but how many hours until they are face-to-face with a licensed mental health professional? For a whole lot of districts, the honest, uncomfortable answer is days.
And this brilliantly illustrates the core distinction we need to wrap our heads around today. Think about paper compliance. Sure, it satisfies audits, it gives you a nice referral list to hand out, or puts students on community wait lists. But clinical capacity? That means having actual named people your staff can call right then and there. It means same-day access. It means actionable, clearly defined steps responses. A binder might flawlessly satisfy a state audit, for sure, but a binder absolutely does not see a student in need.
Moving on to Section 2, the Tuesday 9 a.m. test. Let's take a hard look at the cornerstone of so many response plans, the referral list. The crucial point here is this. If a student presents at 9 a.m. and your primary response relies on handing them, or their parents, a piece of paper with some external phone numbers on it, well, that's just mere documentation. That is not functional capacity. In practice, a referral list translates to days of waiting. It means lost follow-up because once they walk out your doors, you have no idea if they ever made the call, right? It relies entirely on hoping for external community availability. And let's be totally real. In many communities, that external wait list can be anywhere from 4 to 8 weeks long.
Which brings us to Section 3, the reality of school staffing.
Because here's the thing, when functional external clinical capacity is missing, the entire weight of that crisis falls squarely onto the shoulders of your existing internal school staff. We really have to speak with direct urgency about our school counselors right now. The American School Counselor Association recommends a 250-to-1 ratio, but we all know many Georgia districts are operating at double, sometimes triple that number. Relying on a single completely overwhelmed internal staff member for acute crisis intervention creates a seriously dangerous gap. It's unfair to the counselor, and it is a profound vulnerability for the student.
Let's pivot to Section 4, building true functional readiness.
So how do we actually close this gap and build a system that works? Well, true functional readiness looks like a very specific chronological response. Imagine a composite, fictional student presents in crisis. Here are the exact steps your staff must be trained on and able to execute under pressure. Step 1, identify the urgent presentation. Step 2, contact a named, dedicated clinical team that's actually attached to your school. Step 3, initiate same-day access. And I don't mean next available, I mean same day. And Step 4, execute trained protocols with documentation that actually holds up. That is what it means to go from a dusty binder on a desk to a functional lifeline in those crucial first 4 hours.
And, timing is literally everything here. The gap becomes painfully visible in the opening weeks of the school year. School leaders, you absolutely must act immediately. The opening weeks of the year ruthlessly expose the vulnerabilities in those readiness plans. Building the functional system before that window opens, that is the entire point of this preparation.
Let's move to Section 5 and see how this builds into a real answer, the MentalSpace School solution.
This is the turnkey partnership designed specifically to fill that capacity gap for Georgia schools. MentalSpace School fundamentally changes the equation. They provide dedicated therapist teams for every partnered school. Think about what that means. Your staff knows exactly who to call when a crisis occurs. No guessing. They provide same-day teletherapy for urgent presentations, right alongside comprehensive crisis intervention, suicide and violence prevention, staff wellness, and even family counseling. We're talking about a named, dedicated clinical team attached directly to your building's ecosystem.
And this brings us to a massive, incredibly important number, 0. A functional payer model is absolutely essential for true capacity. MentalSpace bills Medicaid at exactly $0 to families. Zero. This is a total game changer. It means families are never, ever put in the agonizing position of having to decline necessary urgent care simply because of cost barriers. The financial friction is just removed completely.
To summarize the whole shebang, this partnership is incredibly comprehensive. MentalSpace provides licensed, diverse, and culturally competent therapists. They're in-network with a massive array of providers. We're talking Blue Cross, Aetna, Peach State, AmeriGroup, you name it. They ensure documentation is strictly HIPAA and FERPA compliant without doubling the workload on your staff. Plus, partnering with them supports districts in preparing for legislation like HB 268. Now, quick aside, we are just speaking generally about readiness here, so you should definitely always consult your own legal counsel for specific statutory interpretation and obligations. But the overarching point, this partnership objectively builds the robust clinical framework that modern legislation demands.
Which really leaves us with this final, vital question to chew on. Are you prepared to build a system of true clinical capacity before the window of opportunity closes this school year? The transition from paper compliance to actual functional clinical capacity isn't just some administrative upgrade. It's a duty. It is a duty to the students who walk through your doors every single day. Don't wait for a real crisis to test your referral lists. Head over to MentalSpaceSchool.com to take action, connect with their team, and secure the readiness your district truly needs.